Picture this. Linda is 67. She's at the pharmacy picking up a blood pressure refill. Normal day. The technician scans her Medicare info, pauses, then says the sentence that lands like a bill collector in a white coat. Your premium is higher because you enrolled late. Linda laughs at first, not because it's funny, because it's absurd. Late for health insurance at 67. But Medicare has a strange personality. It's polite when you're confused and vicious when you're late. No flashing warning lights, just a quiet window you didn't know existed, and a lifetime late fee you can't negotiate. Today, I'm going to show you the map. Simple, clean, so you don't discover the rules from a pharmacist's screen. The myth is Medicare starts at 65. The truth is Medicare starts when you enroll correctly. And correctly depends on your work status, your other insurance, and which parts you pick. This is why smart people still get surprised, not because they're careless, because the system runs on calendars, not common sense. So here's the structure. 4 moving pieces, 3 clocks, 1 trap door. Medicare isn't one plan, it's a base and add-ons. Part A is hospital coverage. Part B is doctors and outpatient care. Part D is prescription drugs. Part C, Medicare Advantage, is a private plan version that bundles A and B, often with D. Then there's Medigap, also called a supplement. That's a separate policy you can buy only if you stay with original Medicare Parts A and B. It helps pay what Medicare doesn't. Here's the first twist. You don't enroll in Parts A and B through Medicare. You enroll through Social Security, and Parts C and D, you enroll through the private plan you choose. So you're not dealing with one sign-up, you're dealing with a sequence. Next twist, some people don't choose anything at 65, and they still get Medicare. If you're already getting Social Security benefits at least 4 months before you turn 65, the government will generally enroll you in Part A and Part B automatically and mail your card ahead of time. That's why some people swear it just shows up. For them, it did. But if you're not getting Social Security yet, maybe you delayed it, maybe you're still working, you usually have to actively sign up. And this is where people like Linda get burned. They assume someone else started the process. Now for the deadline that determines whether Medicare feels easy or feels like a trap. Your cleanest, simplest enrollment chance is called the initial enrollment period. It's 7 months long, 3 months before the month you turn 65, the month you turn 65, and 3 months after. This window is the difference between smooth onboarding and welcome to the penalty lane. Can you delay Part B without penalty? Sometimes, yes, but only if you have the right kind of other coverage. Which brings us to the part that makes confident adults suddenly sound like they're guessing. You turned 65, but you're still working. You have job-based health insurance. The logical brain says, why would I pay for Part B if I'm already covered? Sometimes that logic is correct. But the real question isn't, do I have insurance? It's who pays first. Because if Medicare is supposed to be primary and you skip Part B, your employer plan can treat your missing Medicare enrollment like a missing seatbelt and deny or claw back claims. In many cases, employer size matters. If you're 65 plus and covered through current employment, with an employer that has 20 or more employees, the employer plan generally pays first and Medicare pays second. With fewer than 20 employees, Medicare generally pays first. That 20 is not trivia. That's the line between delay safely and pay twice. And yes, this happens in real life. People keep working, assume their insurance is enough, then get hit with big bills when the order of payment rule shows up after the fact. So if you're working past 65, don't guess. Ask your benefits office, in plain English, is our plan primary for someone over 65 and how many employees do we have? Now, if you truly have coverage based on current employment and you delay Part B, there's an escape hatch. It's called a special enrollment period. The key number is 8 months. That window is often described as up to 8 months after you stop working or lose the employer coverage, whichever happens first. And here's the trap, COBRA. COBRA feels like you're still on employer insurance. But for Medicare timing, COBRA usually doesn't count as coverage based on current employment. Medicare's 8-month clock can start when you stop working, even if you take Cobra. So the sentence that saves people is this: Cobra is not a substitute for enrolling in Part B if Medicare is supposed to be primary. That's a late surprise waiting to happen. Okay, now the uncomfortable part, not because it's complicated, because it's permanent. Part B late enrollment penalty works like this. If you don't sign up when you're first eligible and you don't qualify for a special enrollment window, your Part B premium can go up 10% for each full 12-month period you could have had Part B but didn't. And you can pay that higher premium for as long as you have Part B. So if you delayed by 2 full years, that's 20% added. Use the 2026 standard premium as a clean reference, $202.90 per month. 20% of that is about $40-60 extra every month. Only $40, people say, right up until you multiply it by 12 months, then by 10 years, then by 20 years. And that's assuming premiums never rise again. Part D has different math, same vibe. Medicare calculates it as 1% of the national base beneficiary premium times the number of full months you went without creditable drug coverage after you were eligible. In 2026, that national base number is $38,999. Then it's rounded to the nearest 10 cents and added to your monthly drug premium. And Medicare says that penalty follows you as long as you have Medicare drug coverage, even if you switch plans. The base number can change each year, so the penalty can change too. Translation: miss the window, and you've basically subscribed to an extra charge. Now, even if you avoid penalties, there's one deadline that can still ambush you because it's quiet. Medigap. You get a 6-month Medigap open enrollment period that starts once you have Part B and you're 65 or older. That's the window where you generally have the strongest protections for buying a supplement. After that window, depending on where you live and what you apply for, insurers may be allowed to ask health questions or charge more. So when someone delays Part B because they're working, they often don't realize they're also delaying their best Medigap window. They're optimizing one cost and accidentally gambling on future insurability. This is where marketing enters the chat. You'll hear, Medicare Advantage has zero premium. Sometimes that's true, but zero premium doesn't mean zero cost. It usually means costs move into copays, coinsurance, prior authorization, and network rules. Original Medicare plus a supplement is the opposite trade, often higher monthly premiums, but more predictability and fewer "is this in-network" surprises. I'm not telling you which one to pick, I'm telling you timing changes the menu, because Medigap's strongest buying window is usually that 6-month period after Part B starts, and many people choose or change Advantage plans during fall open enrollment. So timing isn't just avoid penalties. Timing is what options are realistically on the table. Let's make on-time concrete. Say your 65th birthday month is June. Your 7-month enrollment window runs March through September. If you want coverage to start smoothly, you don't wait until June. You line up Part A and Part B through Social Security early. Then you answer one question. Are you taking Part B now or delaying because you have coverage from current employment that truly stays primary? If you're taking Part B, decide drug coverage. Either enroll in Part D or confirm your current drug coverage is creditable and keep the proof. Then pick your lane, Original Medicare plus Medigap or Medicare Advantage, and run the basics: doctors, hospitals, prescriptions, pharmacies. And one more thing that trips people up: start dates. Medicare enrollment isn't like clicking Buy Now. Different windows produce different start dates. During your initial window around 65, you can line things up so coverage starts cleanly with your birthday month. But if you're enrolling late, timing gets harsher. Part B's general enrollment period runs January 1st through March 31, and coverage starts after you sign up, which means you can be uninsured for months if you wait. Plan changes have their own logic. Fall open enrollment changes take effect January 1st, but only if the plan gets your request by the deadline. Medicare Advantage changes during the January through March window typically take effect the first of the next month after the plan receives your request. So the real skill isn't memorizing every rule, it's refusing to assume it'll start right away. Because the most expensive surprise isn't even the penalty, it's finding out your coverage starts later than you thought, after you already scheduled the appointment. Now zoom out to the yearly calendar, once you're already in. Every year, Medicare open enrollment runs October 15th to December 7th. That's when you can change coverage for the next year, effective January 4th. There's also a Medicare Advantage open enrollment period from January 1 to March 31. But only if you're already in Medicare Advantage. It's basically a second thoughts window, and if you missed Part B entirely and need to get in late, there's a general enrollment period from January 1st to March 31. Notice the pattern. If you do things in the clean window, you get options. If you do things late, you get narrow windows and bigger prices. One last twist for planners. Part A can sometimes be retroactive for up to 6 months when you enroll late. That sounds harmless until you realize it can collide with things like HSA contributions. So if you're still working and using an HSA, this is a don't wing it moment. Medicare enrollment isn't a test of intelligence, it's a test of timing. And the uncomfortable truth is how the system turns a calendar mistake into a long-term monthly bill. Linda didn't use Medicare wrong. She just didn't realize she was standing in front of multiple doors. One locks forever, one locks for a year, one locks for life. So here's the question I'll leave you with. If Medicare exists to protect people when they're older and more vulnerable, why does it behave like a contract designed to punish you for being late once, ever? Producer note, not for voiceover. Key references for dates and figures. Auto-enrollment when already receiving Social Security before 65, Medicare.gov, Medicare. Initial enrollment period, 7 months around 65, Medicare.gov, Medicare. 2026 Part B standard premium, $202.90 and deductible, $283, CMS, CMS. Part B late enrollment penalty basics and rounding example, Medicare.gov, Medicare. Part D penalty formula, 2026 base number 38.99 and rounding Medicare.govs and Medicare. Working past 65 rules, COBRA timing and employer-sized 20 employees coordination guidance, Medicare.gov, CMS PDF, Medicare, open enrollment dates, Octi 15 Dic 7, Medicare Advantage, OEP, Jan 1 Mar 31, and effective dates, Medicare.gov, Medicare. General enrollment period, Jan 1 Mar 31, coverage, start timing, Medicare.gov, Medicare, Part A retroactive coverage, note, CMS, CMS,